Very good evening to everyone. We are here with yet another session, and today's session we always talk about naturopathy yoga, but we do not talk about the depth in the naturopathy, the system of naturopathy, the principle of naturopathy. So today, from all over Kerala, today's our speaker is Dr. Sweta Narayan, and she is from the very good place called Kerala in India, and she is graduated from Alwas College of Naturopathy and Yogic Sciences, and she was awarded prestigious Jindal Gold Medal in 2019, and she was the first rank holder in academics in the year 2019 from Rajiv Gandhi University, Bangalore. And right now she is a naturopathy consultant at the Health and Beyond. So on behalf of team On Your Growth, ma'am, I welcome you on our platform for the wonderful topic pediatric health through naturopathy. So welcome you, ma'am.
Thank you so much. I'm honored to have a place to speak on your growth because I can find that this is a very nice, platform where we can promote naturopathy and all its principles and so on. Because I came through this when I was actually pregnant last year. So when I came across this startup, it was very nice. I felt great because I felt proud as a naturopath because not all uh, give an opportunity for others to also flourish as well as this setup is something where I feel everyone gets a chance to speak about naturopathy and its principles and how it can help people gist of what this is actually. So thank you on your growth. Thank you OYG. So I think we shall not waste much time and start off. So today, myself, Dr. Sweta, I will be dealing with naturopathy and pediatric health. So what is pediatric health? Pediatry actually refers to group of we call the child group or the kids or the infants, the toddlers, like up to 10 years, and so they fall in the pediatric category, and we say up to the teens, so they are all pediatrics. So what we say is they go through a number of problems daily. So even I being a mom, I also face enough problems daily on a daily basis. I have a 8-month old child, so you can imagine how many what every stage is different for them, and it is very difficult to manage them on some days. So the main problem or the main cause of pediatric problem that people approach us with is colic. So what is colic actually? So what is colic is actually a kind of a stomach pain, or a tummy pain, or some discomfort that these kids get and they start crying off. Other conditions like respiratory conditions like runny nose, cough, and infestations, nutritional deficiencies, diarrhea, vomiting, urinary tract infections. So these are the most common pediatric problems that we have come through so far. And how do we maintain health? So first we'll go on to how we maintain health and how to tackle these symptoms. So we'll go for maintaining health. How do we maintain it? On what basis do we maintain it? What aspects do we look into? So first thing we look into is adequate hygiene. Hygiene is the first thing. When it comes to kids, hygiene, they are important because they are exposed to this new environment, and they have no idea of what is happening. They are also new. So nowadays the present scenario is that people don't have not people, the world has evolved in such a way that our climate is not consistent. So with this itself, kids, they face a number of problems. And again, hygiene, because you can see fungal growths, you can see dust here and there, you can see worms on food particles, flies sitting on food particles. So hygiene is most important. Next, we go for adequate, hydration, vaccination, and a periodic health checkup on a day, on a monthly basis or so. That will be act for this. Now, why is hygiene most important? Where do you see, or what part of your body do you consider for most important, to be clean? What do you want to keep? That would be hand hygiene. Why? Because you eat with your food, you eat with your hands, you eat your food, you use your fingers. And these kids, you have seen, they go, they touch the floor, they touch their toys, they eat, they touch their food, they put their hands in their mouth. So on this, what do we say, this whole thing of this hand hygiene or hygiene factor, when it comes, the next comes to having a bath. So having a bath, again, why do you need to have a bath? There are people who say, why do you want them to have a bath? But no, having a bath is very important, because see, when you pass urine or pass feces, so when the kid passes urine or feces, they tend to, they're not as clean as adults. Even adults are not that clean. I should mention that also. So make sure they, you teach them to wash their hands properly after using the bathroom. And if they're very young, make sure you clean them properly. They don't, put their hands in the urine or their feces, and you make sure you clean them properly. Give them a bath. So sweat and other thing, and fungus that grows on the body, it grows everywhere in this damp climate. Since we are like the middle of June, it's been raining here in Kerala since 2 days. That too heavy rains, and with a drastic change in the climate from summers to the rains. So you can see a number of fungi growing here and there. Now, so why hygiene? Because you can find diarrhea, typhoid, worm infestations, like when you have 2, 3 kids at home, like pinworms, they transfer from objects here and there. So that is also there. Skin infections, ear infections. So you can see a number of infections. So there is like, n number of infections we go for, why hygiene is important. So make sure you clean them. Now, again, vaccination. Vaccination is a big question. But when it comes to, why do we need vaccination? It is not to boost your immunity, but to tell your body that, such infections or such viral conditions are present outside. So your body needs to actually prepare to fight them rather than getting it and then fighting them. Because in case your child or yourself or anyone else is already, is not vaccinated, and you have the condition, and your body or your genes are not that strong to have a strong immunity, so then what happens is you fall into being fatally ill. So to avoid that condition, immunization schedule has been provided by the government. Like the first one would be the BCG. Then you have the oral polio vaccine, the most important. Then we have the MMR, the mumps, measles, and rubella vaccine. You have the tetanus vaccines. So and so on. The government has a, and yes, most importantly, the rotavirus. When it comes to pediatric health, I'm sorry, I'm not supposed to forget that, because pediatric health and rotavirus is because of rotavirus is such a fatal condition where vomiting and diarrhea coincide with each other, and the kids, they go on, there has been n number of deaths in the northern parts of India, as far as I know. And periodic health checkups, when you say, some people tend to say that, yeah, I'm fine, my kid is fine. But do you think your kid is always fine? Have you checked the weight, the height, the BMI? Are they growing properly? The milestones, are they achieving their milestones? So all these are included under the periodic health check. Now, most important again, nutrition. Nutrition, why? Because undernourished, there are undernourished kids, there are overnourished kids. So the government scheme, there has been nutrition centers. I mean, nutri packets have been, being supplied through the Anganwadis. The government has n number of schemes Through the ration shops, I guess it is only for the adults, but through the Anganwadis, I would request all the, people to at least, mouth to mouth, we can convey this, because there are many people who still don't know why to have a constant monitoring on height, weight, and, the BMI, whether their milestones are being achieved. They have no idea. And even for an example, I could give you, if there is a mild fever, we would actually, when it goes for more than 3 to 4 days, no one is supposed to neglect. We need to get it monitored. We need to know why the kid is having fever. Fever is never a disease, it is always a symptom. So, symptom of an underlying disease. So what I would like to say is, you know I would like to, tell all the parents to go for a periodic health checkup. Not all people are health professionals, not all people have health professionals at home. So take help of the government, you can take help of the Anganwadis, check their height and weight regularly, and check with their scheme. They have provided different books where, the milestone developments have been are being recorded. So ask your ASHA worker or your health worker to, constantly monitor that, and mark over it and all that. So this is what is regarding of how and why to maintain health. What facilities have the government provided with us? So this is it regarding what do you say, how and where and to maintain health. Now, another most important thing is breastfeeding. When it comes to modernized era, people, actually, I would like to say they have a resistance towards breastfeeding. So they are like, if I breastfeed, will I lose my beauty? Is it not good? Will I be restricted from moving outside of my house? But that is not it. You have to, exclusively breastfeed for 6 months. Please do it for 6 months. If you know someone who's not doing that, please exclusively breastfeed for 6 months, because all the required antibodies and all the required nutrition lies in the mother's breast milk. So please put your words mouth to mouth and go and promote breastfeeding. And another thing is like, please reduce formula food or processed food. If you have no other way, like there's very less milk supply and a child keeps crying, and then you insist on saying that breastfeeding is important, that is not the right way. You have to breastfeed, because if you have enough milk, and by God's grace, if your kid is also feeding well, please try and breastfeed till 6 months. And again, hydration, please, check into your kids' hydration, like adequate, whether they're drinking water regularly, whether it be rice water, whether it be juices or anything, not processed juices or preserved juices, homemade juices like with the pulp, etc. Just feed them. So feed them with what is available, rather than, going for all those high funda things and all that. Whatever is available, if you are at your house, at your native, I'm sure there are many people who are at their native and they can get things readily available, rather than the cities, because people at the cities, they have no other go. Like, you don't get cow's milk, like, straight in the morning you get it from the cow. You have to go for those packet milks and all that. So please breastfeed till 6 months and avoid processed foods. Go for low sugar, low salt diets for your baby until 1 year, and later on you can keep introducing foods. Wash your vegetables and fruits well. Don't give them, raw meat and all that stuff. So this is how we can maintain health. Now, when it comes to what problems we face when you have a kid at home. So when the kid is still young and they don't know how to, convey, they keep crying. So main problem, as I mentioned earlier, it is colic. What is colic is, it is unexplainable, because what we say is, the kid keeps constantly crying, and it is very difficult to calm them. They refuse to feed, and they cry after eating. They have a bloated tummy, and they have explosive bubble sounds, like bubble movements. So, and or maybe they have a red circular rash around their anus. So all these are, few conditions where we refer to it as colic. So what colic, we say a constantly crying and, inconsolable fussy baby has a colic. And when it comes to more, elder kids, like, when they're 2 years or 3 years, what they show is they rub their tummy and they say it hurts or something is happening. They're scared, they're crying, and they come and sit on our lap. So when it comes to elder kids, also pediatric area is very difficult. As you know, all the pediatrics doctors, they are doing a wonderful job, because we run to them, we rush to them, because we don't understand what is happening with the baby. So this is what is colic. And how can you treat through naturopathy? We do have naturopathy methods of treating the baby. You can go for a heat compress to the abdomen, a very warm compress, not a hot one, a very warm compress on the abdomen. You can massage in the I love you pattern on the tummy. So you go from your right side, you go like this. I can demonstrate. So this is, suppose this is the baby. You can go for, this is the tummy. So you go for, this is I, this is L, and this is U. So this is the I love you pattern. And you can go for round circular motions as well when your baby, if your baby loves you, and, if they're constantly crying, they won't even lie down. Then you can go for cycling the legs. You can make them lie down and constantly you can cycle their legs. So these are few for the small baby, or you can burp your baby well after every feed. So I can show you how to burp. So when it comes to holding a baby, you hold a baby like this. You put their tummy over your shoulder, above your shoulder, and you tap in 1, 2, 3 pattern from just above the buttocks till the shoulders. So you go 1, 2, and 3. That is in between the shoulder and the buttocks. You have on the spine. So this is how you tap with a cupped hand. And even if that doesn't work, you can hold the baby in your lap like this, upright. You can make them sit and then you can tap gently. So this is another method. And if they don't burp, you can make them lie down on your knee such that their tummy falls on the knee. Hold the chin like this, and then gently you can tap. Okay. These are the 3 methods of how to actually go for tapping or burping, tap and burp. Then when it comes to little more, older kids, what you can do is you can make, what you can give them is pepper, chamomile, and caraway. Caraway, maybe carom seeds, ajwain in Hindi. Yeah, so that is what you can make a tea out of that. And also you can go for ajwain or jeera tea. You can give, you can provide it, you can boil it and then you can cool it down and then you can feed them. This will actually give a relief. And when you give them foods, make sure you give them adequate water, and don't go on feeding them. You can give breaks in between and feed them only as much as they want. There are some kids, those who don't eat at all, so it's very difficult for the parents to feed. So you have to use alternative methods. Now what that is it about the colic. Now we shall go for the respiratory conditions and what we can do. Like, these kids, they're very, very, very susceptible to infections like runny nose now because school classes are not there. There are very less infections happening. The recent researches are on this. Like, since the schools are shut, there is no more cold, runny nose, or cough. Sounds funny, But yes, it is true, because the viral infections, they transfer from one to the other, and kids, they are very susceptible to these things. So when it comes to respiratory conditions, what conditions are common? As I said, common cold, sneezing, sore throat, runny nose. So this is it. So what are the conditions? What are the symptoms they face, or the signs that you can see? Mainly, there is a very fussy baby, a fussy child. They refuse to eat, they refuse to feed. They have an slightly increased body temperature. They have sore eyes. There's a tired child. There's a lack of play, like they're not interested in play. Um, or sore eyes, like they have red eyes, and watery eyes. So all these things are the symptoms of a respiratory condition. Now that COVID is also another well prevalent disease or a viral condition, so we need to differentiate that too. So what I say is, in case you find such symptoms of the baby can anyhow not explain that it is being sick, or I have a condition, like I have lost my smell, lost my taste and all that. The baby cannot anyhow say, or kids, they don't explain. So what I would say is, rush to the nearby hospital, only because COVID-19 is prevalent, because we don't know who, when, what and where a person can be affected. So, and since it is quite symptomless these days, it's very difficult to differentiate in kids as well. So you need to monitor their temperature as well. So what are the treatments that we can do at home, or naturopathy treatments? What I would like to suggest for a baby, not a baby, but all the pediatrics, or the kids, is you can give them steam with tulsi leaves. Tulsi, I don't know, I don't think anyone in India wouldn't know, because tulsi is that prevalent in India. It is a sacred plant. Yes, it is sacred because it is used for almost all the conditions. You're not well, your smell, it improves your mm, sensations, sensory nerves. It stimulates them. So hence, steam with tulsi leaves is the best when it comes to a respiratory condition. Then you can go for, if you have a slightly bigger kid, you can go for tulsi jaggery ginger decoction. So what you have to do is, when it comes to kids, you have to add a little more jaggery, so that it is sweet, and the other tastes are on a milder side. But it's not that you have to add less, add adequately, but keep the sweet on top. Don't add white sugar, but add jaggery, which is also good. On the other way, like when it comes to nutrition, I'll just explain now. Or you can go for, you can steam the Indian borage, or the Coleus aromaticus. It is just like tulsi, it's another leaf. So you can steam those leaves. Those leaves can actually be roasted on any tawa or anything, and then you can smell it. You can smell you can squeeze it and you can smell the leaf, or you can take one drop into each nostril. Now you can, and this is one, when kids are slightly big, you can go for gargling with warm water. Not only warm water, with salt and turmeric. Why turmeric? Because it has antibacterial properties, and salt as well has the same. So these are the naturopathic treatments on a sharp note. Now let us go for the most next one, which is worm infestation. What do you think is worm infestation for kids? So when it comes to kids, worm infestation is actually, a very severe condition when it comes to the other worms, the round worms, tapeworms, um, hookworms, etc. Pinworms are the most, uh, relevantly, or prevalent worms, which is found in all the babies. So you can go for deworming as well once in a while. But what are the symptoms that they show? They go for diarrhea, vomiting, and unexplained weight loss. Your kid is having food, but he's not gaining weight. So we have, I've come across people, see, I've been feeding her this, I've been feeding her ghee, I've been feeding her banana, I've been feeding her, nuts, but she doesn't put on weight. So this is one thing. So it can be, a worm infestation can be prevalent there. Constant cry when it comes to babies, tenderness on the tummy, on the stomach, or bloating, or passing worms in their stools. So these are the conditions and these conditions are mostly seen when there are more than one kid at home. So when there are two, three, yeah, if one gets the condition, so you better go and treat the second one too, because this is highly contagious. Now, what is the treatment? You have to provide the kids which are with foods with high amino acids and fatty acids. So such examples I would like to give you is pumpkin seeds, flax seeds, beetroot, and all that. But you can't feed them these seeds as such. So you have to roast them, add some honey with it, and then you can use it as a spread. Excuse me, as a chapati, on a chapati, or anything of that sort. And also vegetables with high beta carotene. What are the vegetables with high in beta carotene? Those are carrots, sweet potatoes, squashes, etc. They contain beta carotene. Means are mostly like orange colored products, like vegetable products, like see, carrots, yes, squashes, the pumpkins, the sweet potato, such things. They are high in beta carotene. And why beta carotene? Because it resists the penetration of these helminths. See, these helminths, they tend to lay their eggs just beneath the skin, or in the intestinal tracts here and there. So the best form would be to use such things which prevents their entry. So these beta carotene rich foods, they actually prevent their penetration. Then we can also go for probiotics. So what are probiotics? Probiotics are food with the natural bacteria. So we can go for yogurt, you can go for curd, you can go for buttermilk, you can go for hung curd. So these are the things rich in probiotics. Buttermilk, I mean, kids usually love curd and buttermilk and all that. So it's not a big deal to, feed them with these. And in case they don't like all these, you can go for, other recipes like curd rice, or um, masala buttermilk, or you can add a bit of sweet and salt to the curd and make it palatable. You can add beetroot to it so it gets a pink color. So these are the ways where you can actually promote your child to have probiotics. And you can also add vitamin C and vitamin B rich foods, like citrus fruits, and vitamin B rich. Almost all the non-vegetarian stuff contain vitamin B, like the meat, the chicken, the fish, and beet, the I'm sorry, beans and eggs, and all that. So it would be a better thing if you go on for all that. And you have to avoid, what should you avoid giving them? You should avoid giving them meat and or fish. So you should avoid all this. Raw meat and raw fish is a complete no to the kids. Or you can't go for sushi and all that, because in case these things are infected and you don't know, you are indirectly you're putting your child into risk. So please avoid that. Now that's all with the worm infestation part. When it comes to urinary tract infections, uh, we have like what or how to detect urinary tract infections. Now Kids may go for frequent urination. They may cry while urinating, or they explain they have a pain while urinating. There's a burning sensation. And they complain of a pain on the tummy or at the back. So such things are indicative of urine infections and the foul smelling urine. So when it comes to babies, they don't know how to explain. So when it is foul smelling urine, they have cloudy urine, blood in the urine. So these are another set. Now, yet another most important and most neglected things are, vomiting, excessive vomiting, high fever, and body aches. So these are also another, set of symptoms that the kid faces, or generally we miss out. They come with vomiting and they have high fever. You give the medicine for that, and you just forget that it might be urine infection, because in kids they say no, they won't have. So that is the reason why we ask the parents always to keep their kids, hydrated well. Now, how can we treat them? You can hydrate your kids well with, juices or water, rice water. As I mentioned earlier, like, any of the juices, tender coconut water. That is one which, any kid likes tender coconut water because it's sweet and, it looks like water, but when they taste it, it's kind of surprising for the kids. So when it comes to older kids, they are also, they also love tender coconut milk. You can include citrus fruits like passion fruit, amla, and orange, lemon, etc. So that is also very good, alternative of citrus. You can go for lemon honey juice. You can try a variety of things. Like with the kids, you can keep experimenting always with the food, not like in a wrong manner. Like you heat up the lemon and then you lose all the vitamin C, because as everyone knows, vitamin C it vaporizes quickly. So always see to that when you provide your kids with vitamin C, make sure you give it as it is and not heat them, because once you heat vitamin C or orange, it loses all the the vitamin part of it, because vitamin C is kind of vaporized. Then you can go for plantain pith juices if it is available, or you can make plantain pith sabji with you can add other like potato or anything else with that, and you can just incorporate plantain pith into this and give it to the child. So the plantain pith as it is very blunt. So kids usually they are always in a quest of search, or in a quest or search of uh, new things. So new things like these are, you have to try out experimenting with foods. And now that's all with the urinary tract infections. So what I would say is, please hydrate your child well. Now we go for nutritional deficiencies. So nutritional deficiencies, one of it's women these days, men, kids are always there in the group. Kids and women always fall into the group. Men, yeah, these days men are also falling into the group of nutrition deficient people. Now why? Because their eating is not right. Maybe they're eating everything, their eating is not right, absorption has a problem, people don't know how to incorporate what into what, how and where. So when it comes to anemia, which is the most common, like 47% of the preschoolers are affected with anemia, and 25% of the kids are always affected. So why is this? And how to find out? They'll be tired, they'll be weak, they'll be pale, and there's a lack of energy. They lose, their kind of interest to play and all that. Hair loss, unexplained weight loss, increased frequency of infections, like they don't have much immunity, they have a lowered immunity, and at the worst case, if they have impaired brain function. So So the treatments, so these are, how and why and all that is almost known in case of anemia. But what is the treatment and how to treat them, properly is what people don't know. So the dietary sources, like, of iron are like, we have the heme part and the non-heme iron. So non-heme iron is found in, red meat, organ meats, organ meat like liver, kidneys, of me of the, non-vegetarians will know, like liver and kidneys of the goat, of the buffalo and all that, provided that they are cooked properly. I would like to, highlight this point of cooking meat properly, because worm infestations come from raw meat and fish. So please try and cook your meat properly before you provide it to your kid, as well as you consume it yourself. Shellfishes and sardines. Sardines are a very good source of iron. They're in fact the most nutritious fish, I would say, because almost all the minerals are found in sardine. And sardine is actually locally, caught, not locally caught. It is the most commonly available fish, I would like to say. Then the heme part, you can go for the green leafy vegetables, like, spinach, the Indian spinach, the other varieties of spinach we have, palak and all that. You can go for the moringa leaves, the drumstick leaves. They are also very rich in iron, I would say. Then you can go for pumpkin seeds, sesame seeds, the black yellow we say. Okay, squash seeds, broccoli. And when you have all this, what would you combine with iron so that the iron that you eat is absorbed? See, I'm eating a lot of red meat doesn't mean my hemoglobin is apt. Why is, the hemoglobin not increasing? I'm giving my child the red meat, I'm providing him spinach, I'm giving him that, this, but still he has anemia. Why is it, doctor? Why is it happening? So the answer to this question may be there is poor absorption. So why is the poor absorption of iron? So iron requires citrus, or vitamin C for its absorption. For its adequate absorption, please have, you know vitamin C, like, lemon. You can squeeze lemon over your, or the food, over the spinach or over your meat, so that, it is palatable, as well as it does as good, like, it is like, plus two benefits. It's palatable, as well as it helps you absorb the iron. So this is how it is done with anemia. Now, so I'm done with anemia. So we'll go for vitamin D deficiency. Now, vitamin D deficiency, we can say it is not as common as in abroad, because here in India, I believe we let our kids out to play. But this again is a controversy, because when it comes to Indian cities, all the kids are still at home. They are sitting at home. So, sitting at home is not a good thing. So sitting at home inside the house with no, no exposure to sunlight, so it reduces the immune function. There are growth delays, soft bones, and it leads to rickets. So there is reduced muscle health and all that in these kids with who are vitamin D deficient. So why vitamin D deficient? Because, earlier, when you take, like, 10, 20 years back, there was not much people or much kids suffering from vitamin D. Because now these days, when you get discharged from the hospital, what is the doctor asking you to give? Your doctor asks you to provide your child with 0.5 ml of vitamin D drops daily. Please do not forget it. Daily provide them this until they are 1 year old. It is because of all these conditions. Because these days people are giving not much importance to, playing outside or anything, because they say the UV rays are, very harmful. Yes, it is harmful, but at a period of time, you should allow your kids to, get exposed to sunlight. Let them play so that the vitamin D gets activated in your skin. So these are, this is like what this is a condition which is, which is like, an ongoing condition which is going to come in India, because these days kids are, being closed inside there. Now these days there are no schools as well, so I believe kids don't go out at all, because one thing is COVID-19, next thing is no school, so you don't see sunlight, you don't go out, either the TV or the screens. The screens are also very, very, you know harmful, I need to say. Then we'll go for the treatment part. Treatment part, I would like to say cod liver oil. Fish oil, again, I'm mentioning, I would like to highlight the point of sardines, because sardines are, rich in vitamin D, and fatty fish like salmon, mackerels, all these are rich in, vitamin D. Now, egg yolks are also rich in vitamin D. So when it comes to vegetarians, they are the mostly affected category. So I would like to, you know, uh, point out a point on letting your child play in the sun early in the morning, like around 6 to 7 or 7 to 8, till 8 and not beyond that, because these days the rays are very harmful. And the evenings, the light sunshine from 4 5, like that. And that is it about, the vitamin D deficient part. Then we could also go for iodine deficiency. So these days kids are deficient in iodine, because iodine is the most important mineral, for your thyroid functioning. So what is thyroid? Is like, thyroid is a gland which is situated just above the trachea, on both sides of the trachea, on your neck. So what happens when you are deficient, or your kid is deficient in iodine? So one third of the world's population now suffer from, iodine deficiency. And it might be because, that either the mothers are deficient when they are gestational, so their kids are indirectly, um, suffering from that. So these are conditions which go hand in hand. So they have an enlarged thyroid gland, they have a shortness of breath, and there's an unexplained weight gain or a weight loss. So both these conditions of hypo and hypothyroid need to be explained. Mental retardation, so, and your kid has a delayed development in milestone achievement. So these are, the most commonly seen problems in thyroid deficient, I mean, sorry, iodine deficient children. So what I would like to say is, use, iodized salt. And too much iodine in your salt will also cause, a restrictive, iodine uptake in your body as well. If you provide too much, that is also not, accepted by your body. So what you need to do is, you can go with foods. Food can really correct your iodine, I believe, like kelp, seaweed, and, as I mentioned, as always, I'll be mentioning sardines in the fish. Dairy, eggs, etc. contain iodine. So include iodine in your baby's food, in your kids' diet as well. So if you are probably fish eaters, there wouldn't be a much problem. Next condition is cobalamin deficiency, that is vitamin B12. Most, again, 80% of the vegetarian kids fall into this category. It causes megaloblastic anemia, impaired brain functions, elevated homocysteine levels. So that is the test for, finding out what your kid is deficient in. If, there is an elevated homocysteine level, we conclude it to be, vitamin B12 deficiency. So how can you treat it through food? You can go for meat, organs. Okay, organ meats like liver, chicken, liver. Yeah, like non-vegetarians will know meat like liver of the goat, buffalo, kidneys, and all that. Provided that you cook them very well. I'll keep mentioning that until the end of the session, because cooking is also important. But it's not that you cook your orange and you give it to your kid, because cooking orange is equal to providing them with just hot water. So again, coming back to a cobalamin deficiency, you can go for shellfish, cheese, yogurt, paneer, and all the brands like oat bran, rice bran, the full fortified cereals are also a nice option which you can provide to your kid. You can make upma, you can make a variety of things with all that. You can make cakes, you can make dosas, you can make idlis, you can make a variety of things. You can make chapatis out of the bran. You can powder them and you can use them. You can also provide them with almonds. You go for almond milk, or you can go for almond soaked almonds. You can give it to your child. So these are all the options in tackling cobalamin deficiency. Now the next one is calcium deficiency. Again, it can be combined with the vitamin D deficiency. Again, here calcium deficiency is deficient. So when you have a calcium deficiency, you might be having a vitamin D deficiency, or you have an impaired thyroid function. So these things are all correlated. So I'll just I'll just point out what are the symptoms, like soft bones, stunted growth, weak muscles, cramps, bow legs, etc. Bow legs, yeah, everyone knows those are rickets. So that is the condition when it comes to extreme or severe calcium deficiency. How can you treat it? What are the alternatives other than milk? You can go for ragi, you can go for sesame, you can go for milk, you can go for cheese, you can go for curd, paneer, and you can go for all the dairy products. You can go for green, dark green leafy vegetables, and you can go for the white bean variety, the white beans that we use for cooking. Uh, Soya milk is also another alternative. Almond milk. So everything contains calcium. So this is how you can make up for the calcium, deficiency. Now, last but not the least, my last thing is protein, protein deficiency. So this is again kwashiorkor and marasmus. These conditions are, prevalent in Africa even now. Here, yes, in the rural parts of India. So why are kids protein deficient when you have 2-3 kids? This disease of the weaning child. That is what is, marasmus. And the kwashiorkor in the first year if you find protein deficiency in your child. So that is very, 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 very lethal. So let's see what are the symptoms. They have decreased immunity, delayed growth rate, joint pains. They don't, obviously they don't know how to explain joint pain and all that when they're very little. Poor concentration, the lack of mood of play, decreased muscle development. They're all, they're very thin. They have a delayed wound healing. So these conditions, are actually, are suggestive of protein deficiency. So what happens in kwashiorkor and marasmus? I'll just differentiate. Swelling of ankles, feet, and belly. There's, the skin, it has a rusty texture when it comes to kwashiorkor. Then loss of muscle mass and flaky rashes on the skin. You get flaky, rusty rashes on the skin. Then when it comes to marasmus, again, chronic diarrhea, respiratory infections, intellectual disability. As I mentioned, the IQ is very low in these kids. Stunted growth or delayed growth. And when it comes to marasmus, because it is the, cry of the weaning child, we say, disease of the weaning child, they'll be deficient in iron, iodine, zinc, and vitamin A. Because then people still don't know why they, why we delay pregnancies, why there's a gap between two kids. This is to provide adequate nutrition for the first child and then move on to the second child, being the ideal gap between two kids, be it 3 years. So this is how it has been explained. So before 1 year, when that is the reason why people are asked to stay on a safer side, use condoms and other contraceptives to keep your pregnancy away, so that you can actually look after your first child properly and you actually give a better, healthier condition, better health to your first child and then move on to the second one. I just deviated, so we'll come back to the protein deficiency and how to combat or tackle protein deficiency. You can have seafood as always, eggs, lean meat, beans, peas, nuts and seeds, soy milk, broccoli, quinoa seeds, lentils, pumpkin seeds, Brussels sprouts, peanuts, Greek yogurt, chicken breast, almonds, eggs, etc. are rich in protein. So you can go for all this to tackle the protein deficiency. So this is what naturopathy has to do in pediatric health, and how can we prevent all this is through diet and diet only. We have to provide the food and as well as make a note on how it is being absorbed in your child's nutrition as well. So what I would like to point out from this session is exclusively breastfeed your child for 6 months, and only then go for introducing solids and wean your child by at least 1 to 2 years. But please exclusively breastfeed till 6 months, because it is very important for their health, for their immunity, and for their nutrition and all the aspects on that side. And keep a gap between your kids. When you plan for kids, keep a gap of at least 2 to 3 years, so that your first child is adequately fed, breastfed, and then is weaned on a right path. And then you plan for your second one, so that the nutritional deficiencies are also not prevalent, as well as you get time to look after both the kids properly. And this is the adequate method and method of moving forward. So I would like to stress on points like please use immunity increasing foods, like try to stay away from medicines, try to improve your immunity through your diet, through you don't have to stay away and from other things, and you don't have to have a conflict with the outside world, but try to improve your immunity through your food. Diet is the best way. We have to eat, and we eat to live, not live to. So on this note, I'd like to end this session. Thank you, OYG, for giving me this platform to talk on naturopathy and pediatric health. Thank you so much.
Thank you so much, ma'am. It was a great talk in terms of knowledge, in terms of perception, how a naturopath should look to these kind of diseases which they are not aware of. They just see a basic non-communicable lifestyle disorders. So we are not restricted to that part, that we should understand as a naturopathy student, doctor, or senior doctors, those who are in the field of naturopathy. So it's not consolidated to one part we should treat, not to other parts. So if this approach, if they see in this session, and they should learn from your approach, and they should go to a different path, just not nutrition to not lifestyle disorder. They should go nutrition to pregnancy factors or pediatric factors or geriatric factors. So everything is important in our field. And thank you so much, ma'am, to come and show the perspective from, if I say, colic disease to the protein diseases, what you have covered from basic to most complicated disease. So thank you so much, ma'am, to come on our platform. It was a great pleasure to having you. Thank
Thank
you.
you so much. I have immense pleasure to address that. I have had a session with OYG. So thank you so much. Thank you. We'll meet again.